Hello everyone, welcome to my YouTube channel. So I'm going to be answering some questions which I will try to divide into different videos, okay, of questions that have been sent to me from someone. I think it might benefit us as well. So basically we're going to be looking at someone went for an interview and they showed the person blood film morphology or peripheral blood film, which is PBM. And the person was asked to identify the key features. So we are going to get into that. Before I continue, my name is Emmanuel Obodo. I'm a biomedical scientist and I'm also a lecturer in biomedical science. So let's get into this. So this person has been to an interview and the person was asked, please identify the most common features. I want you to note the most common features on this blood film. That means when it comes to blood film morphology, you must understand that it is not everything that you just see that is actually clinically significant. Okay, it doesn't mean that it doesn't mean anything, but is it what you've got to ask yourself, is this thing clinically significant? Okay, right. So what are the most common features you can see here? Obviously, you got to ask yourself, what catches your eyes first? What exactly catches your eyes? Now, let me try to explain to us. I don't know if I did mention this on my previous video on morphology, but let me say this. When you are given a blood film to identify, you've got to ask yourself, what exactly am I looking at? Okay. Now, remember, in blood film morphology, there are key blood cells that has to be identified, okay, or has to be commented on where possible. One is red blood cells, two is white blood cells, three is platelet. Make no mistake about it. So these three main blood cells has to be commented on, whether you think they are normal or whether you think they are abnormal. But in this context, maybe we're going to focus on what is abnormal. So you need to, once a blood film morphology is given to you, anytime you go for interview and they give you blood film morphology, ask yourself, what are the red blood cells like? What are the white blood cells like? And what are the platelets like? Okay, so that is what we are going to be looking at. Now, if you think like that, it will be easier for us to be able to ask ourselves, what exactly is obvious here? Now, let's start with the red blood cells. One thing that is very obvious that I'm sure they really want you to comment is the fact that there are malaria parasites here. There's a malaria parasite here. There's a malaria parasite here. There's a malaria parasite here. Okay, I think there's also a malaria parasite. So what is here is a presence of malaria parasite that is present here. And let me also say this. So in malaria parasite identification, obviously you can see that this is ring form, okay, of the malaria parasite. So what is now up to us, where possible, is to determine what exactly is the species of that malaria parasite. Are we talking about falciparum? Are we talking about malaria? Are we talking about knowledge? Are we talking about, like other type of malaria parasite? Okay. Now, let us say that this is Plasmodium falciparum. Okay. Now, obviously, there's a malaria parasite here. In other words, there is Plasmodium falciparum here. So, what it means is that anytime we identify malaria parasite, as you can see here, it is important to quantify the amount of that very parasite on the red blood cells. So it's important that you conduct what we call parasitemia. So you have to calculate the amount of the parasite on the red blood cells. So that is parasitemia. That means the amount of the parasite on the red blood cells. Okay, so that is important. But I think that is not what I need to focus on now. So the question is identify. So what we can see obviously under the red blood cells is that there is presence of malaria parasite, okay, possible Plasmodium falciparum. Right. Now, having said this, what are other things you can see here when you talk about the red blood cells? Is there other obvious things you can see? There are many things I can see here, but we need to be careful. Let me just tell us some certain things. Let's say something like this. This is maybe you can say a chinocyte, okay? And this is also maybe a chinocyte, I would say. This is also a chinocyte. But they are not much for you to really comment on that. If I were you, I wouldn't bother, okay? Now, but there is also something very obvious here. If you look at it, there are a number of macrocytes here. Some of the, of course, let's put it in general. The red blood cells appear to be in different sizes, okay? Some of them are normal, some of them are bigger. For example, if you look at this, this is bigger. If you look at this, they are bigger. Most of them actually, they appear very big. Does that make sense? Okay, they appear very big. So now, what you can see here as well is macrocyte. So there's a presence of macrocytosis, in my own opinion. Okay, again here. Now, when you see things like this, you are likely to see polychromasia. But I guess the staining is not very clear. You know, if I should call any of them polychromasia. However, what you cannot deny is the fact that some of the sizes of these very red blood cells appear very big. So if you look at this, you can see because of the different sizes, some of them appear normal, some of them appear bigger, as the case may be. So we can use general word if you don't want to say macrocyte, but there are obvious macrocytes here. Macrocyte mean that the sizes of some of the red blood cells appear big, okay? However, if you really want to put it together, we can see that we are seeing anisocytosis. So under the red blood cells, we've seen malaria parasite is present. Under the red blood cell, we can see that we have some anisocytosis. Does that make sense? Okay. Now, there are some of them that appear to be different shapes, but is not significant enough from what I can see for us to call them poikilocyte or poikilocytosis. So I will stay under red blood cells, malaria parasite present, okay, and of course anisocytosis. That is fine. Now, if you look at this blood film morphology, there is something I'll say towards the end. If you look at this blood film morphology, you can see there is no presence of white blood cells, not neutrophils, not monocytes, not eosinophils, not basophils, and not lymphocytes. Okay, so we can't see any white blood cells here. Okay, so we can say there is what? Leukopenia. In fact, severe leukopenia. Does that make sense? So there is absence of white blood cells, or white blood cells not seen, therefore leukopenia. Do you understand me? Okay. Now, that means you are identifying that there is no white blood cells, so leukopenia. That's severe leukopenia. Leukopenia. Okay. Severe leukopenia. That is very important. Now that you've said this, another type of the blood cells we can look at is something like platelet. Can you see any platelet here? I can't see any. There is no platelet here, in my own opinion. And because of, again, the absence of the platelet, we can say that this is thrombocytopenia, severe thrombocytopenia. So now let's put this together. In this identification, what are the key things? Under the red blood cells, we are seeing malaria parasite, we are seeing macrocytes, or you can say anisocytosis. Okay. Now, under the white blood cell, we are seeing leukopenia. Why? There is absence of leukocyte from what we can see. Now, of course, we cannot see any platelet again. That means there is what? Thrombocytopenia. Okay. Now, so, but that is your identification here. But having said this, let me say something quickly. It is possible that there can be white blood cell on another field, but I think that it doesn't necessarily mean that we don't see. I'm sure that if you go to different field, you might see one or two white blood cells or platelet, as the case may be. But this is one field I think we are looking at. Okay, but I think that in this interview, what they really want you to see is the presence of malaria parasite, and perhaps what you can do in terms of calculating parasitemia. Okay, now that is what I think this is talking about. But remember, thrombocytopenia can also be likened to the presence of what? Malaria parasite. But I want to stick with the question they've asked here. The question is, what is the most common features you can see here? The presence of malaria parasite and macrocyte or anisocytosis. And like I've said, there is absence of white blood cell from what we can see, and that is leukopenia, and absence of platelet, and that is thrombocytopenia. Right, I hope that makes sense. Okay, right, please do let me know what you think about this video. Okay, this is just overview of what I can see. So thank you very much, and I don't know if you have any questions. Let me know what you think about the video. Tell me, is there anything I missed? And don't forget as well, if you are already practicing and you have experience, feel free to put a comment on the comment section to add additional comment of anything maybe I may have forgotten. That way, whoever that comes to that video can be able to see something that can as well benefit them. All right. Thank you very much for listening. Please, can I ask you to like, share, subscribe? I wish you all the best till I come back your way again. Bye-bye.